Is it me? Am I the problem? Consistently across multiple provinces in Canada, I've lived in Ontario and BC, I have felt intimidated and underserved by a healthcare system that just feels sexist and a little homophobic.
So, as a woman in this world and seeing what's happening in society and bringing up even the word sexism, I think that's very important because, like, when I say these kinds of things, I feel like there's a lot of pushback from
Mm,
medical providers and the medical system at large because there's something about being labeled sexist that is so offensive.
I'm a fairly confident person. And I would also locate myself as very well resourced in the
Mm.
world. I have a lot of power and mobility to navigate systems, to express myself, to assert myself. I am really anxious in a healthcare setting. Part of my vulnerability is physical in nature because if you are literally naked or half naked and you have a practitioner who's doing some kind of physical exam, I can't think of a lot more vulnerable context to be in.
Hi, off the charts. Welcome back. You know who I am. I'm introducing you to the Dara Parker.
Sure, I'll take the additional honorific.
It's well deserved.
Thank
Dara is one of like my long-term friends, and she has been with me through thick and thin over the many years, but also has been a like peanut gallery for all things happening in medicine and in society. She's one of the smartest people I've ever met in my life. And I really love her perspective on things. So I've invited her here. We'll have her bio and things like that. But I really wanted her here because I love talking about society and medicine and society and health in general, and a lot of things about my identity as a queer person, as a brown person, as a woman come to play regularly in our conversation. So really wanted to introduce these kinds of concepts in addition to like talking about PCOS and talking about endometriosis and talking about hormone therapy. So welcome, Dara Parker, to the podcast at Off the Charts.
Thank you so much. Let me translate what Bobby just said. I'm going to bring a non-technical lay perspective and a user perspective because mostly I experience the healthcare system as a patient.
So let's get right into it then. As a patient, what is your actual like experience from your perspective as a patient in our healthcare system as a woman specifically? Because I want to talk about like women's health a lot from that perspective.
My favorite subject is women.
Yeah.
And so, in a nutshell, mediocre.
Mm,
Yeah. I
that sounds terrible.
I know, and I have asked myself over the years because I'm now a middle-aged lady, so I have many years of experience. Is it me? Am I the problem? Consistently across multiple provinces in Canada, I've lived in Ontario and BC, I have felt intimidated and underserved by a healthcare system that just feels sexist and a little homophobic.
That is, I believe, most women's experience, if not most people's experience, when they really think about it. You share that understanding?
Yeah, I know a lot of people that have been underserved and I reject the binary. I have moments of brightness. In fact, I'm one of those Canadians who hasn't had a primary care provider for most of my adult life. And my partner and I just found a nurse practitioner that's taking on new clients, and we've had a really positive intake. Um, it was pro woman, pro queer. Um, I think they brought, like, racial literacy, and it was a young brown woman who is our and so I think her own social location that doesn't guarantee that kind of experience, but it
No.
probably increases the odds.
Yeah, I feel you put me onto this place as well until I've had my intake there as
Oh,
well.
and how was it?
I'll tell you about it later.
Okay, wow, a teaser.
It's so as a woman in this world and seeing what's happening in society and bringing up even the word sexism, I think that's very important because like when I say these kinds of things, I feel like there's a lot of pushback from
Mm,
medical providers and the medical system at large because there's something about being labeled sexist that is so offensive,
right.
and both personally and then to say that the system that these providers are working in also is labelable that way kind of condemns them or condemns
Actors in the system.
How do you feel about that? And, like, do you think, because even today, I'll tell you this, like, somebody put a post, and, like, I'm obviously on social media, and a lot of what I put out there is quite direct about this kind of thing. They're like, "Oh, we're in a sexist system." The reason that we got to where we are with even, like, menopause therapy, how did we go 25 years without providing hormone therapy to women who needed it? How did that happen? Why was it taken away? And it's everybody sort of parses and says, "Oh, a study was done, and the study sort of said
Mm.
things were bad, and so all doctors decided this is a bad thing. Estrogen's terrible. We should just stop using it," even though the evidence suggested otherwise. And if you really looked through and understood what was happening, you'd question all of it. So my explanation is, oh, it's because we are in a sexist society, and medicine is therefore sexist as a result of being part of that society. So of course that's why that happened. But
Right.
people don't like when I say that,
No, why do you think the resistance to that idea is? Because that
because it feels confrontational,
Mm.
and it feels like I'm minimizing complex systems, which is weird because I'm trying to maximize it.
Yeah.
Minimizing complex systems of public healthcare funds and research funding and, like, safety and
Yeah.
all down to, oh, you're
It's
blading.
the system.
It's the system.
It is the system. That's the unfortunate answer, friends, is that I do think that is a more complex analysis translated simply. But of course, systems are us. I think sometimes we think of systems as big, audacious, you know, complex infrastructure that exists out there in the world. That's true, but they also live within us because we create the systems. Like
Yeah.
we've designed the systems. And so there are intangible components of the system that really are rooted in our values, our beliefs. And the world is sexist. We live in a sexist world. So the healthcare system is a fractal of the world at large. And therefore it is
I told you there's a reason that she's here, and this is why. I just love having this kind of perspective shared because I I speak to this. I love having a woman say it in the way that you're saying it because you say it just better than me, I think. And it's you do. And I and I love that I get to have other people not sort of like clap back at me for this and say, like, no, like, you're right, that's what it is, and not sort of find ways to tear down my argument or like try to find the sexism, because it kind of, people will say that me doing that is creating more problems than trying to solve the problem.
well, we have to understand the problem if we want to try and change it. And so let's just have a realistic conversation. And I think I get the defensiveness. Which of us wants to be complicit in being sexist?
Mhm.
I don't. In the same way, I don't want to be complicit in racism as a
Mm,
white person.
mm.
For me, there's some relief in understanding these are forces beyond individual choices I'm making. It's not, I don't like women and therefore I will act sexist in a sexist manner. Like my embarrassing story as a lifelong raging feminist is, and I have many, I choose one embarrassing story for this podcast.
Can't wait for this.
I'm at essentially a queer women's party, my people, and making small talk with someone who talks about their shift work and why they can't, maybe join this event next week because they work shifts. I was like, oh, and I knew they worked in the healthcare system.
Mm,
And my response was like, oh, are you a nurse? And guess what, Bobby?
I already see the problem.
They weren't a nurse.
I'm embarrassed to hear the rest of this story.
To tell this and record it forever. My point being, so spoiler alert, she was a doctor, and nurses and doctors are all important healthcare practitioners. However, I made an implicit assumption that I was deeply embarrassed about making because I know better.
Yeah.
I know women can be doctors or nurses or many other things in the healthcare system. But my point is it's so deeply embedded that none of us can individually extract ourselves from the system, and we get caught in different moments and we have different degrees of awareness. I have a pretty high degree of awareness and I still did that.
Yeah, I say the same thing too. I'm sexist. How could I not be? I'm the product of a sexist society. The things that I'm saying to my patients, my female patients, I need to be checking in with myself regularly about, like, and I do this. That's why I speak to you, and I speak to other women and other queer people and others all the time to try to understand, do I have it right in the way that I'm speaking? Are my intake forms correct? The way that I'm writing? Is the way I'm delivering? And it's never going to be perfect ever. But the idea for me is I should probably be checking in with myself and other people to understand if I'm on the right path and having the conversations because there's no way I escape sexism.
No.
There's no way I escape racism. So I will be actively making, without knowing about it, actively saying and making decisions that are rooted in, I mean, we just had this conversation earlier with a group of doctors about, so there's an understanding there. I don't know if you know this, but in gynecology, there's an understanding, and it's old, but it still pervades, that women gynecologically at the level of the cervix do not feel pain.
Cool.
Yeah.
It
That they
sounds
don't feel pain.
scientific.
Yeah. So we don't offer nurse.
Did we test this on men to get to this conclusion?
Guess the answer to that. No.
No, I feel like maybe the data set was men, and they're like, "Look, men feel no pain in their cervix. Done."
The craziness of how the smartest human beings on the planet, the people who had to go through rigorous, like critical thinking, analysis, examination after examination, they go through that process. Love doctors. They're the best people in the world in terms of saving people's lives, but they go through this whole process. At the end of it, practicing for 5, 10 years, are like, we don't need to offer pain medication for women because they don't actually experience pain when you insert a foreign object into their uterus through their cervix opening. They don't feel that, and so we don't offer it.
Well, that's good news to women of the world.
And now we know, we always knew this, but the fact that we had to study this to like know this, that there's loads of nerve endings in the cervix. Of course you feel pain there. Of course that makes sense. So we should be offering trauma-informed pain management
Mm.
to these people when we're inserting foreign objects into their bodies. But that hasn't, how did that get missed? So of course we're
Yeah.
products of that society because we're still making decisions that are based off of that sexism that exists. And yet we have to like analyze all the things that we're doing from that lens at the beginning of the day, at the end of the day, be like, could that be a problematic thing that I'm doing? To even ask the question, I think. But we don't ask ourselves the questions enough.
Do you think healthcare practitioners center humility in their practice?
No.
Because I think this is true for many professions, and this is outside of mine, but I think that's a key to unlocking knowing what you don't know. And the more I learn about medicine, the more it feels like a combination of science and witchcraft. Just kidding, art. That there is a lot of unknowns, but truly, I think it's a combination of art and science, and there are many unknowns. And so, if that is true as a baseline, then entering the practice with some humility feels like a core characteristic of practicing good medicine.
What are the cliches that are based in reality about doctors? They have God complexes. You hear that often.
I have experienced a level of certainty and superiority within the healthcare system that troubles me. That's my more diplomatic way of saying yes.
Yeah. Me as well, from my perspective, knowing what I know, being like pretty aggressive with my approach to things when I feel like there's an injustice happening. To me, to show up in a medical setting and then also be gaslit, knowing that I'm being gaslit about something, and then I'm like the rage that I have, but I'm unable to find a way to get that provider who's on the other end, who's the one lighting the match, um, for them to see that that's happening
Right.
because there's this power dynamic, and that's as a man, fine, it's as a brown person and all that goes with it, and queer person and all that goes with it. But, like, it's hard for me to break through that with that person because there's an ego, there is a ready defensiveness and a boundariedness against what I'm about to approach that
Mm.
person with, and it feels confrontational when it's not. So I think this is setup. It's a setup for it all to sort of be like, how is there gonna be humility if there's already this feeling that something is gonna be critical of that person? Like,
Yeah. And I have tried to put myself in the doctor's shoes. And I have some empathy for in the age of information and misinformation in the internet, a patient coming in being like, well, I Googled this and I think this is my diagnosis.
now it's chat queening everything.
Sharp.
GPT everything.
Chat is my best friend. But I get that. Like, I get some hesitation. If I've if you come into my office and something I've worked in for 25 years and you Googled it and feel like we're equals, okay, I have some hesitancy. And we have to start from where you started, that the entire system was constructed on a sexist and racist and homophobic infrastructure. And so let's be open to that. And, it's not either or, it's not good or bad. We have to, for me as a patient who's had mediocre experiences in the healthcare system, I am I am sensitive to like this is not my area of expertise, but I'm looking for a doctor who wants to partner with me, share their expertise, and not, drop the God
Mhm.
complex at the door.
Do you think that the medical system is able to escape the constructs that are flawed in society as a separate thing, or does society have to be the change
Like, what's the
first?
order of
Yeah,
operations?
like,
No, it's a both and. I mean, change in complex systems is nonlinear. And so you're tackling it from all different places. And there are bright spots in the healthcare system.
why she looked at me when she said bright spot?
I think so. Not only, I mean, you're my friend first, but also sometimes my naturopath. And it's been a refreshingly positive experience. I feel like I can walk into the space and there's a degree of trust that I won't be dismissed or intimidated or assumptions won't be made. That very frustrating. And there are other bright spots. So I think change happens in all different kinds of ways, and it's individuals and it's policy advocates and it's the meta conversation and it's funding pathways. You just fund women's health. Like if we want to get quantitative about it, the research dollar is going to understand women's health issues compared to men's health issues are wildly disproportionate. So there's lots of ways the change needs to happen.
It's amazing how some studies, there was one recently where it was a study on understanding men's um, perspectives on and I think it was a very expensive study, men's perspectives on what happens to women in healthcare. And it was like, wait, what?
Why? Who funded this?
Uh,
Why do we want to know this?
It made the news. It was just like, why do we spend money on understanding or caring what men thought about what's happening to women in healthcare?
Maybe because they have so much influence in the system?
Probably. It was probably some curiosity.
I mean, I'm not immediately dismissive, but I'm certainly
Uh, Let me
curious.
tell you, it's worthy of being dismissed. So when we look at this for me, and also there's like this element of curiosity, like the reason I'm not dismissive and the reason, I mean, there's more of it than that is I'm always curious as to what your experience is in this life. Like we have very different experiences. I remember at the very beginning of my relationship, I'm with a wonderful Irish man.
I like that guy.
Yeah, who's white. And at the beginning, and
One
like,
of those white
yeah,
Irishmen.
it's a very white
Mm.
Irishman. Hi, Rob. At the very beginning of our relationship, when we were traveling, because we would go back to Ireland and we'd go to other places in addition to going to Ireland, I warned him of what it's going to be like to be a uh, co-passenger with me traveling through airports.
Right.
And and he was like, "What, really?" And I would say that to his family and his friends. I was like, as the years will go on, you'll be witness to things that happen to me at airports. And most people, when you say that, are just like, there's
Right.
no way anything really materially differently happens to you. And then I get stopped, sent to a different area. I get, I'm randomly searched, even though nobody in front of me for the other 50 people that were there were randomly searched. I'm the one who is literally physically stopped from leaving the airport.
Yeah.
After you go through customs, after you go through security, after you've left, you're about to leave the airport. And somebody who works at the airport, a security person, just goes, "Where do you think you're going?" And they get to witness that then. They're just like, What? No, this person's with me." "Oh, okay. Carry on then." The permission that needs to be had for that person, that security officer, to know that I'm safe because I'm in proximity to a white person.
Whiteness.
And they just don't realize. So live that and I know that. And then other people get to then see that. And so there's no way I'm going to make any prejudgments about somebody else's experience in this world, about what they felt and how their day goes. And when they say that happened to me, or it's because I'm a woman, it's because I'm black, it's because I'm
Right.
here. I'm like, "I'll believe you first. I'm not gonna not believe you first. I'll believe you first and then hear it from that angle."
Right.
Be like, "Yes, that makes sense that there was sexism that happened to you because 'cause we're sexist. Yes, racism happened to you because 'cause we're racist. Tell me your story." And then we get to come from that place first rather than convince me that that happened to you because you're a woman.
I mean, that's powerful. In my experience, even having lived experience of discrimination in its various forms doesn't naturally translating to believing all other types of discrimination. So I'm glad that's been an entry point for you. I think I had to do more work personally to understand experiences that weren't my own. I've been the white person in the equation at the airport. And so just acknowledging my own blind spots and shortcomings. And I think what you're talking about is some conscious work. When your patient comes in, you start from a point of belief. There's so much unconscious bias that's already happening. You started this by asking me about my experiences as a woman in healthcare. And, if I'm seeing a new healthcare practitioner, I'm aging. So this question is dropping off. But I still get questions about birth control right away. And so the question is, are you on birth? My answer is mostly been no. And then immediately I usually get some form of a lecture on why I should be on birth control. I guess it's paired with the question, "Are you sexually active?"
Ah.
Uh,
Uh,
anyways, friends, we all know what the spoiler is here, right? My form of birth control has been lesbianism.
Best kind of birth control I know.
Yeah. So, of course I'm being a little bit cheeky in the doctor's office because I'm answering your questions. And if I don't trust the practitioner and I don't know how they're gonna react to my sexuality, maybe I'm making a judgment of my own about how much am I revealing? How much do I want to share? Which will interrupt my ability to receive holistic healthcare because I'm choosing which information I'm going to share with them. That's a simple example. I think it's happened
That's a
over and over.
great example.
Oh, you've this has happened to me many times.
Yeah, no, I get that it would happen. I get that it would happen often, but
People are obsessed with my sex life and birth
yeah,
control. Okay, doctors.
what you said though after that was like the comfort of choosing what you want to reveal to the person that's supposed to know all things about you in that context.
No, I am always selective about what information I'm sharing in a healthcare office. Always. I said this to our mutual naturopath friend Zainab once, and she also clutched her pearls a little bit.
Yeah, I'm like gooped a bit.
Are you?
Yeah,
No, absolutely. If I don't, because I haven't had a relationship where it's trusted and long term, it's always restarting. And I don't start with trust. I start with nervousness and hesitation and anxiety around being judged. And so I selectively share
yeah.
information.
About judged from many things. It sounds like not just like you would be selective about more than one area of your life.
Yes. Yeah, absolutely. And then the other thing I'll say, because I've thought about this a lot and talked about it with my partner, in general, I'm a fairly confident person. And I would also locate myself as very well resourced in the
Mhm.
world. I have a lot of power and mobility to navigate systems, to express myself, to assert myself. I am really anxious in a healthcare setting.
You
I
said that to me last time we talked,
Yeah.
and I was just like, this person is the person who was at like I won't tell you what she does for work, but it probably involves lots of like brain work and communication and technical and
Me?
yeah, yeah,
Brain work. So much brain
brain
work.
work, navigating.
Yeah.
And then but she was on the show called Unfiltered. I used to watch it all the time, and I was like, she was like taking people just what'd you say? Like, like anxiety from you sounds so foreign as the two wouldn't
I
match.
mean, I'm human. I feel anxious, but I am specifically pointing out that one of the places I feel least confident in the world is a doctor's office. And, this is true for me. I suspect it's true for other women. There is so much baggage around our bodies. I think around human bodies in general, and specifically women, we've spent so much time disassociated from our bodies, disliking our bodies, trying to change our bodies. And, I all of that is true for me to some degree. And I just don't, I'm just not comfortable there. And so I think about that and it connects to this trust and then what information I'm going to share with you as a healthcare practitioner. And then, of course, we look for signals when we're in a new environment. And a signal of, "Are you on birth control? Let me give you a lecture about it," is not the pathway to building trust for me. I immediately think, "Okay, you haven't even considered that I might be queer. You're not asking any follow-up questions. I'm not seeing any humility. And in fact, we went moral. Okay, uh, maybe you're not thinking."
Same.
And I haven't had
Same.
a primary care
Yeah.
practitioner for 25 years.
Like if a person like you, who has all the things you just described about yourself, has these hesitations that are based in fear and insecurities around revealing something that might then get like a judgment
Yeah,
to it. Yeah.
yeah,
Imagine what it's like for everybody else. Like this just means this is such a tell that so many women go through this. All of the training that's done that society just embeds into all of our brains, but then especially women's brains about how you feel about yourself, how you feel about yourself with respect to other people, how you feel about taking up space in the room, taking up space in a medical office. What is this God gonna say to you if you say the wrong
yeah.
thing or reveal the wrong thing? Are you gonna get lectured for 5 minutes about something that has nothing to do with you because there was this like um, complete lack of understanding of who you are in the
Or
first.
just curiosity.
Yeah.
Like, I'm not expecting you to be an expert on me. Ask a question. Like, do a quick follow-up. Just express a little curiosity. And I'll also stress part of my vulnerability is physical in nature because if you are literally naked or half naked and you have a practitioner who's doing some kind of physical exam, I can't think of a lot more vulnerable context to be in. So it is not just the emotional vulnerability. Literally, there is a physical vulnerability to the context.
Why was this new experience you just had so different from what you've had before? You like
Mm,
you speak of it in a very different way than your history with medicine.
yeah. Well, some of it was energetic, honestly, and that's hard to translate to you.
Yeah.
But I think it was rooted in there was a queer competency. So I'm describing stories where I imagine everyone does this consciously or not, but you're sort of testing. You're sharing a bit of information and seeing how they react,
Mhm.
right? And so in an intake, I might, share something about my female partner and I. And if there's like no blank, no, and just like, it's a boring Tuesday morning and they're I can tell when someone's surprised and when they're not, right? So that was one indicator, like zero surprise.
Do straight people clutch their pearls?
Well, so here's maybe a different lived experience. I'm gonna take a guess here, is that you probably don't get read as straight very often.
Never.
I do.
Not once.
So I get lots of surprise in my life because people, if they don't have me in any context,
Sorry, correction. Women over the age of
think
65.
you're straight.
Yes.
Well, shout out to those ladies.
Yeah, women grannies think I'm straight. And I'm always just like,
Don't ruin the fantasy for them.
yeah,
Really.
I'm sure your granddaughter is lovely. Also, I'm almost 50. Like, I'm always like, I'm 46 this year. I'm just like, thank you so much, Mary, but no, like,
So mostly you are read
eh,
as
mm,
a Gaylord.
yes.
And I am often not.
Mm.
And that means I have lots of experience gauging people's reactions to learning this information in different contexts. We're talking about healthcare, but it happens at work, it
Not
happens.
gauging.
Well, yes, exactly.
G-A-Y. Jig.
Oh, I see what you did there.
Thanks.
The best jokes are the ones that are explained, but I should spell more. Yes.
Sorry for mansplaining that. Gauging,
Gauging.
actually.
Yeah, it was more. Yes.
Okay.
We're all on the same page.
Yeah.
I was like, I'm missing something here. You're like, let me spell it. So I have experienced that in doctor's offices and, it just chips away at the confidence. So back to what felt good about this, there was a queer competency. My partner also saw the same practitioner separately, but felt really good about racial competency,
Mm,
which is important to my overall family
mhm,
well-being. There was uh there was a much more consent-based approach to engaging me. "Are you comfortable with this? Can we do this?" Like, I've had experiences in doctor's offices that are like, "Now you're gonna get undressed and I'm going to do this." It's like, "Okay." So it's like those are subtle shifts. I think that all contributes to the energetic I feel like, "Oh, okay, I'm in like, I feel comfortable here and I feel like I can build trust."
and this person, because they also live in some of these worlds, like in a person of color world, they might come at it differently. Not always the case because they also live this life from that lens too.
Yeah, I'm connecting those dots.
Yeah.
Again, it's not I've had negative experiences with female doctors as a woman, so I don't think your social location
Oh, I've had negative
automatic.
experiences with gay professionals.
Yeah.
Just like,
Yeah.
are you kidding?
Yeah.
Yeah.
So it doesn't automatically translate, but I think it increases the likelihood. And, similarly, I I think you could have a really positive experience with somebody who doesn't have that social location, but it takes some active unlearning.
I'm so glad you found somebody because if you've had this history, this vulnerability, like checkpoints to be like, how vulnerable can I be with somebody who's we're meant to be the most vulnerable with these people so they can know us because it's our bodies and the things that happen to us and our embarrassing bits and the things that happen to us that we don't want to tell anybody else, but we should be able to feel like we can trust this person to help us figure that thing out. I'm so glad you found that person.
Well,
So
let's not get ahead of ourselves. It's early days, but I feel
maybe else just their name just yet.
no, we can't show this sucker. No, I feel optimistic, and I intentionally, when the opportunity presented itself, went with a nurse practitioner because I felt like there might be a different mindset around how they approach medicine. Similarly, working with naturopaths over the last 15 years, I feel like the mindset is different. It's not, so literally the system is different in that it's not a 15-minute visit or it doesn't start with a 15-minute visit, which mainstream public healthcare does.
Yeah, I've been told that too. That the public system doesn't have the time because the visits are so short. They have to get right to the point,
Yeah.
like parse through everything else, nor the funding to care about um sexism and racism and homophobia.
Expensive.
Yeah, it's too expensive to like spend time
Yeah.
on those kinds of things because we're still busy saving lives, catching cancers, et cetera, et cetera. That is just like, that's not realistic for how our system is built. So,
Yeah.
what do you, sure, go see a private provider who's able to offer you those kinds of things because that's not the way this works, honey. And you're just like, okay, I
I mean,
get,
that's a disappointing response, and I would agree with the assessment that the system is not designed to provide optimal healthcare, that the system is really focused on symptoms and not root causes and efficiencies and was, designed by white men to serve white men. So the system is doing what it was supposed to do. The question is that still the outcome that we
yeah,
want to
it's just can't be
achieve?
disappointing itself if that was the aim from the get go.
But I think most people have a higher aspiration around not just band-aiding the solution, a very apt metaphor in conversation, but really trying to understand, what are the root causes of someone's health issue? And, that takes into social determinants of health. And how can you possibly provide holistic healthcare that's going to fundamentally help people if you're only looking at one type of.
That's why, I mean, this isn't a horn tooting thing. It just makes sense that you would then not want to be part of a system that doesn't allow for you to then spend the kind of time that you would like to have in order to understand these kinds of things, to spend the kind of time like reading and learning about these biases that are going to influence the way you're going to deliver care because you are. It's a number of years ago. It's wild. I think it was 10 years ago that medical school graduates were asked in a sort of like a creative way in surveys, how they would offer pain medication to different groups. And it was understood through the analysis of these surveys that they would offer pain medication and pain management at a 50% less rate to Black women than they were to everybody else. This is not.
I
This
mean,
is
there have
not.
been multiple studies on this
Oh, it's
point
over and
that
over again.
Black women don't feel pain,
No,
which is
over and over again.
ludicrous.
This is literally in the last 10 years. And that we know those things are true and they still reveal themselves to be true. And yet we're not really having the conversations to be like, how do we then correct that? Because one, we don't have the time. Who's going to pay for it? And then who's going to train en masse hundreds of thousands of providers who are already built into a bias system?
I mean, yes, and we literally have infrastructure across the country training people en masse to learn about these things. Some of shifting the system is about political will and incentive. Like, we're not starting from scratch in terms of how do we educate the masses. You're talking about retroactively,
Yeah.
supporting practitioners in the field. I'm just making the point there is a continued pipeline of practitioners who are being trained as we speak.
Yeah, I'll say not from a pessimist perspective, but from my perspective, um, that it's going to be a very long, arduous uphill battle, to see these changes, and that's honestly the reason why I want to sit with you here with
Mm.
these mics, because if even one clinician is watching this and makes a spark in their mind to be like, "Maybe I should," like, one of the things I was saying to somebody else, not too long ago was, like, if the beginning of class, if we're in, like, gynecology class,
Never been there, but
yeah, look, if we're in a lecture, there's 500 of us, the very first gynecology class, they told the history of, like, gynecology, and in that history, for 5 minutes, they just revealed, "Oh, a lot of the things that we learned were from, um, violently, coercively using Black women's bodies as experimental bodies, without pain when we cut into them to
without
cut
pain meds.
without on purpose, because we wanted to see how much pain that we could cause. How painful is it to cut into a uterus? How painful is it to cut into a vagina? How painful is it to remove a uterus? How painful is it to, surgically, treat a fistula in a body, with the bodies that are available that we can use because, access to a free body that can't do anything about it, is a Black body. How we learned a lot of what we know in gynecological surgery came from a handful of Black women who were tortured, who
Right.
were absolutely tortured. If gynecology class started with that, if we just learned the history of where some of our shit came from, then maybe, like, it would spark something in the class who may be the majority not Black, majority not women, majority not whatever it is. Maybe their brains would just go, "Are you serious? Is that how we got here?"
I love the idea of introducing more history. I think that's important, and the sociology of medicine, which I think is my impression is it's undervalued in the yes, and that's such so critical. What I wanna emphasize is sometimes people's reaction to this kind of information, maybe to some of the stuff you talk about on this podcast, is guilt and therefore defensiveness and therefore, like, shut down. It's not helpful, and I would express caution around introducing that kind of information in a way where it fosters that guilt,
Mm.
because
Oh,
that's
that's
not the
interesting.
point,
Yeah, right.
and that is not particularly helpful, uh, and, one of the ways I think about this in social change is to be hard on the issues and soft on the and even in this conversation, I hear judgment from you on the doctors who don't get it and won't do anything.
Oh, I get pissed.
I get it.
Oh, it's like a ra
As I
it's
want
an
to as
inferno.
yes.
It's a rage.
I will offer you the the invitation to consider if that helps advance your cause.
I'm not sure. I'm and this is not an area where I will say that I have, like, a learned competence in communicating and delivering this. I just show up as I am, and I haven't done any kind of training to try to make a change here. I just have the conversation and fight. But I know that's probably not. I get it. I get
Look,
it.
I practiced a lot of that in my 20s and 30s, and my, data sample has suggested it's spectacularly unsuccessful. And, I mean, it's great at, feeling some rage release at the frustrations around what doesn't work in the system,
Yeah.
if that's the goal. If the goal is more than that, you actually want to shift the conditions, you want practitioners to bring these lenses into their practice. I honestly don't think it's right to hold individuals accountable. To some degree, yes. I mean, we make individual choices, but we've started by acknowledging this is a system that's greater than any of us. And helping people get out of the guilt, feeling bad, also removes some of the paralysis or forget it, I'm out, the shutdown. And I really don't think yeah, I've said this a few times, I don't think it's helpful to feel guilty. It's helpful to be knowledgeable. It's helpful not to ostrich it. That's the bird that's their head in the sand?
Is
It is.
no,
Fact check
we
that.
never will.
So all of that is helpful. Sharing history is helpful, but doing it in a way that invites reflection, perspective, shared accountability without moving into that paralysis, guilt, defensiveness. And I think many of us change makers unintentionally lead to that outcome when we get judgy, when we get judgy about if you just knew, then you would act different.
I think like, yeah, I have the humility.
Good, because we talked about that. We talked about that, Bobby.
Wait, hold on. Let me get my ostrich
Yeah, yeah, yeah.
out of the sand. And I have some humility to know that there are things that I definitely need to improve on in this way so that if my goal is to try to enact some change in this, I need to deliver the message in a way that is not guilt inducing and not defensive inducing. It's just I'm so used to having the person on the other end get already defensive
Yeah.
that it's already like a foregone conclusion that it's going to be a frustrating conversation. Even the idea, you did this, you did this. Years ago, you used the expression um, feminist forward medicine.
Did I?
You said in my house.
Have we trademarked that?
No,
Oh, we should.
should.
So
It's a feminist forward medicine. And she said those, and I said, oh my God, I love the way that hits my brain. And I got it. I was just like, yes, I want to consider myself a feminist forward, not meaning that I'm like exactly right as what I'm doing right now. It's just that I would like to be.
yeah, an
And
intention, a
yeah,
commitment.
yeah. And I've had that in my brain on any post I'm writing about. I say feminist forward and I don't credit you. Uh, sorry.
Understood.
Royalties are
Could we slow down the podcast and just freeze here?
uh end here. Yeah. Oh, what a great episode, everybody. Catch you later. But when I say feminist forward to other people, there's this like,
Well, it's one of those polarizing words.
yeah.
So you love it, I love it. I love the word feminist. I am strategic about when I use it.
Mm,
If I think it's gonna be an impediment to the conversation, I don't use it. I don't lead with it. Not because I'm afraid of it, not because I reject it. I actually love the word, and often it is the right word. But I am more interested most of the time in trying to have an engaged conversation, and there's lots of trigger words that shut people down,
right.
and that's one of them. Feminist is one of them.
Yeah, I've learned that. But yeah, it's just the moment I say that word, there is a kind of fear that like penetrates the space that it's
That
gonna
they're gonna be
go
judged.
that it's gonna go somewhere uncomfortable.
Yes.
And that the person who used that word is in some way going to come for them.
Yeah. I
Just
think that
because
yeah.
you and it's I'm just like it's actually shocking. It's actually shocking
Right.
every time. I'm just like, so that it's revealing a lot about you actually who had that reaction to me. And my instinct is to be like, oh, let's figure out where this goes. But I mean,
This is a really rich conversation as I anticipated,
yeah,
and I think the opportunity here is to reflect on what are you trying to do in that
change their minds.
then I would broaden your vocabulary.
Mm,
I would find different on-ramps into the conversation to get at the same point, and I just white supremacy? So a trigger word,
mm.
privilege.
Don't I know it?
Privilege, even just using the word privilege, total trigger word. So there's lots of language that I scrub from my vocabulary, not exclusively, but in a lot of contexts because it's just not helpful.
The word privilege makes people already think that you are going to devalue the struggles they've had in their lives
100%.
automatically. And
That's not
I've
helpful.
learned that. No,
Yeah.
I've learned that
Yeah. So
about that
feminine might
word.
be in that same camp.
Yeah. The moment you say privilege, and I try not to say it anymore because it automatically makes a person go, you don't know what I've been through. And you're just like, whoa, that was not what that was about. Um, I would love to have a conversation with you about how that's not what it's about. But then I'm just like,
Well, we are changing this into the Bobby Dara podcast, are we? No. Is
unfiltered. To what me six. Speaking of Parker, you have parking that's up. So
wow, see what you did there?
I always so we're gonna cut it here because it's already been a lovely hour. But thank you so much for joining us. And I think this is gonna be very um exciting for people to sort of hear this kind of thing on a medical uh, podcast where we talk about more than just like, oh, what do we give for this? I really wanted to give out more than that. And that's why it was so important for me to have you here. And so thank you so much because it was already more than I could have ever hoped for.
I love what you're doing, and it's always a treat to be in conversation with you.
Thanks. Yeah, I'm back. Bye, everybody.
Bye.
Thank you so much for joining me today. I really had a great time, and I hope you did too. Please share this with a friend or a lot of friends, and leave me a review. It really helps promote this podcast. Thanks so much.